Oh, good day, and thanks for joining us today on the webinar by Indie Practice. We're presenting Diagnosing Your Practice's Online Health and Is RPM Right for You? For those of you who have registered, the webinar today is sponsored by Indie Practice, which is a new initiative from the Medical Association of Georgia, and VenOps, a compliance company partner that focuses on protecting independent medical practices. Today we'll be introducing Practice Beat, a comprehensive patient acquisition system with tools usually only available to large health systems and that is available in a single inexpensive platform. Also, we'll be introducing Medic Health, the nation's only remote patient monitoring service that offers a complete RPM solution. Our first guest today is Rick Cancellaire, the CEO and founder of Practice Beat. Rick is a visionary and an entrepreneur with a passion for helping patients get the healthcare they need. As an award-winning designer, he brings an aesthetic of design purity and efficiency to his work that delivers results and value to his medical practice clients. Our second guest will be Lamar McMichael, who is the Senior Clinic Advisor for Medic Health Systems. So without further ado, I'm going to give the platform to Rick and allow him to share his screen. And give me a second here to do that.
Thanks, Mark.
There you are.
I just wanted to confirm you could hear me.
Loud and clear. And I'm going to turn my my camera off, so it's all yours, Rick. Thanks for joining.
Okay, well, perfect. Thank you so much, and thanks everyone for making some time to connect today. I wanted to talk specifically about what blocks patients from finding medical practices, because we help independent practices outperform health systems on Google. And I want to start by asking, what if I told you there is this giant wall that's preventing hundreds of patients from finding you every month, and that wall was built literally to route patients away from you, and that Google is the wall? You watched them destroy the yellow pages over the last 10 years because they're constantly checking your credibility, testing your performance, and assessing your authority, and shifting patients away from you or towards you. They literally built a massive floodgate to redirect a wave of patients away from you or towards you. Are they evil? Why did they do this? No, they want to give patients amazing experiences. And they look at that as if credibility, performance, authority, and they trust practices for three main reasons. These elements, right? What makes up your trust? What makes up your performance? And what makes up your authority online? And based on these factors, you either fail the tests and Google passes you up and other practices win the top positions, or you win the top positions. Practices like Atlanta Bariatrics, when you search for bariatrics doctors in Atlanta, they're #1, right? The physicians for pain medicine in their market, right? Foundation Psychiatry, psychiatrists near me, right? And these are, full disclosure, these are practices that we work with. But why does that matter? Well, let me just show you for an example in Myrtle Beach. If I just look at Myrtle Beach and I type primary care doctor near me, what you don't see in this picture is that there's 110,000 searches per month for that search. So thousands of patients do not see you when you don't show up for these searches. And what you see about your practice offline is not what Google sees online. And what you see online is not what Google sees online either. Google changes their algorithm literally thousands of times a year, hundreds of times a month. It's impossible to keep up with them as an independent practice, right? There's all these different pieces to their algorithm. panda, penguin, spam, hummingbird, pigeon, mobile, Fred, right? If you Google penguin, you'll see a penguin with a knife if you click on Google Images, right? If you Google panda to read about that piece of the algorithm, you'll see it with a gun. It's kind of strange, but each component is reviewing you, and working with Google is really hard. You have to deal with HIPAA, accessibility, performance, the ADA, your search engine results placements. There's a lot to kind of handle with it. And what we did is we made understanding it and working with us very easy. And the first thing we do with any practice we meet with is we pull their market share. We show them how much traffic is available in their demographic, in their specialty, and how much they're missing out on and what they're actually getting. So for instance, in this market, orthopedic doctor near me gets 246,000 searches per month. The practice we were meeting with is position number 22 with almost no market share at all. We pull that detailed market share for everyone. This is free. There's no cost to the market share, the competitor diagnostics. We pull the data on each competitor and we show you why you're being outperformed in these areas and why, and what the value of each one is. We give you clarity and a patient leakage overview on what blockage and what leakage elements are preventing patients from finding you on the impressions, leaking out on clicks, leaving you on sessions, and not converting on your site. And again, this is all at no cost. We then build a treatment plan for you at no cost. How do you increase your share of search? How do you decrease your bounce rates? How do you increase conversion on your site, right? And what is the opportunity in terms of net new patients for even doing this? We offer optional support services if you want help, but it is a member benefit for anyone involved with indie practice or the Medical Association of Georgia to get this assessment at no cost, get your market share data, understand your patient leakage, and understand what options are available to actually improve if it makes sense. And we run those diagnostics for all attendees. You can get your data, and you should. And for select attendees, we'll even give you $50 to give you your data, right? All you have to do is scan the code and book time with us today. And if you're an independent practice leader, if you're taking new patients in a suburban or urban market, we will pull your data and run that information for you. So I want to talk about how we diagnose patient access and what we do, and then I'm going to jump in and show you real quick how to book that appointment again. So here's an example practice we work with, Barrington Orthopedics, right? The first thing we did with them is we pulled their online market share. We showed them how the highest volume searches in their market, they were positioned 102, 6, 89, 99, and the highest volume searches that were happening, right? They were unaware of their blockage and patient leakage issues. Our patient access experts that are staff nurses that work for us, they're all RNs, they run over 2,000 tests and queries to assess your visibility on your market share, your performance, your credibility, your authority, your patient leakage, and they assess your competition, right? And they show you in third-party assessments where you are not performing. For instance, Barrington, they didn't know that it took 20 seconds for their site to load, and over almost 40% of their visitors were clicking the back button, right? They didn't know that they had that kind of patient leakage. They didn't know what pieces of the algorithm were impacting them. They opted to have us go in and help them, and within 30 days, we completely revamped everything, and today they're number one in their market, right? And I like to show that they're number one on the local pack, and they're number one organically. And they have over 1,300 five-star reviews, and their doctors even perform as well as the practice for searches like orthopedic doctor in their markets, right? When we started with them, their Google Search Console was going down. After we worked with them, it's a hockey stick going up. Their impressions and their clicks go up. We track that data. We present it to them quarterly in growth calls. We track their return on investment for them. We do this for all of our customers. In their first month, they hit a 2,600% ROI. We track ROI for all of our customers, and we present it to them quarterly with all the other metrics. Practices that pass the test win the top positions. We launched this arthritis clinic last month, and in the first month, they got 140 requests from patients, and they asked us to turn it off to actually pause their systems, and which we did. But the idea is an independent practice, like a small sleep medicine practice in Malvern, PA, right, can outperform University of, or Penn Medicine, right, on Google. You'll notice Penn Medicine's number 2, this single doc practice is number 1, right? Our goal is to help independent practices outperform health systems on Google, and that's what we do. And again, we will run your diagnostics and pay you to do it if you're an independent practice leader that's taking new patients in a suburban or urban market. We want you to see your data, and we believe it's very valuable to show it to you. You can scan or go to connectrick.com and book an appointment directly with me, and we'll send you a $50 Amazon card.
Rick, that was fantastic. We've got a couple of minutes for any questions that may pop up in the chat box. I also put in the chat box that if they don't get an opportunity or if they don't have their camera in front of them to scan, they can email us at info@venops, and we'll pass them on to you and also to the Medical Association. Do you have another, you got your email on there, I see somewhere, right? Yeah, Rick.
Actually, they can just go to connectrick.com and book right there.
Okay, great. That's good. I don't see any questions pop up just yet. Also on the panel today, although he's muted, we have the CEO of the Medical Association of Georgia, Jeremy Bonfini. And it was also, I got a text during your really good presentation that I forgot to introduce myself. My name is Mark Maloney. I'm the founder and CEO of Venops, and we're partnering with the Medical Association to bring you indie practice. We are fanatical advocates of physician practices and especially independent medical practices. And we really, really love what Rick does of sort of equalizing the playing field between the small independent practice or the big independent practice and those big health systems. So I think our next presenter, we'll move on, is Lamar McMichaels, who is the Senior Clinical Advisor for Medic Health Systems. So Lamar specializes in helping physicians enhance their practices by providing expert guidance on implementing effective remote patient monitoring strategies. He is a healthcare industry veteran who has held numerous executive positions and is uniquely qualified as a certified physician practice management consultant from Cornell University. So I'm now going to switch presenters here. Give me just a second. Okay. And Lamar, let me get you off mute. Are you available?
I am.
Okay, good. There you are. Are you going to need the screen, Lamar, or are you just going to talk?
No, I will not need the screen.
Okay, very good. I'm going to spare everybody my webcam. And you want to turn your webcam on so they can see you?
I thought it was on. Is that on now? Yeah, there we go.
You are? Okay, welcome.
Great. Thank you. Thank you very much. Rick, that was a very impressive presentation you made. I had no idea that that tool was available out there that can help practices. Very powerful. Medic RPM, Medic is an RPM provider, Medic Health, and Medic Health is part of a 18-year-old software design firm that has been in telemedicine since its inception in January of 2020 when CMS decided to incentivize the physicians to adopt RPM as a way of reducing the overall delivery of healthcare, primarily through reducing the number of readmissions to the hospital and or the emergency room. And it does that to the tune of about a 70% reduction. Most of the audience probably has some cursory understanding of remote patient monitoring. What I'd like to emphasize today is Medic does remote patient monitoring a little differently in that we do everything that's involved to give our practice a profitable and productive RPM experience. There's actually no workload for the practice to provide RPM for the patients, since Medic does everything from onboarding the patients, shipping the devices. We have a clinical team that's made up of RNs and above, and that clinical team is available. Thank you, Mark. That clinical team is the ones who are touching the patients whenever their readings are outside of the normal boundaries, and they're the ones who are coaching the patients in ways to help improve their chronic condition. And by doing that, we relieve the doctor's staff from any of these responsibilities. The only thing the physician and his staff need to do is to respond to a text message, an email, or a voicemail where we've notified them that a patient readings are out of bounds and they need attention. Other than that, we're doing everything else. If we can stipulate that Medic has a better approach, then we need to understand that a practice can earn somewhere between $180 and $200 a month in newfound revenues by providing remote patient monitoring. And that's revenue that the practice hasn't previously had. The Mark is popping up the CPT codes that we can go over in a individual call if anyone would like. But there's 3 reoccurring codes that are billable every 30 days, and they provide the revenue flow to the practice. And again, our team is doing the work to populate the codes that Mark's showing you now. But the return on investment for RPM doesn't stop with the reimbursement for the practice or the improved quality of care for the patient, but it also reduces the operational cost, including staff workload, administrative cost, improves efficiency and patient engagement. It enhances the resource allocation for a practice. It can help automate some of the tasks that would otherwise require staff time and effort to complete. It improves the overall efficiency and reduces the cost associated with the manual process while decreasing the number of tasks for the provider and the staff, allowing them to focus more on the priorities of the practice on a daily basis. So RPM, remote patient monitoring, if you choose the right remote patient monitoring partner, provides not only the ROI in income, but also benefits the practice in reducing the number of patient touches required to keep track of the patient, because we're doing that for them. The importance is picking the right partner. There's very few, if any, practices out there that have a model similar to Medix, in that we are a full service provider, even down to the very end function of billing the insured payer or CMS for the services, since we have a wholly owned private billing company that's been billing RPM for almost 3 years now. And the advantage of that is, if your billing company, your billing team within your practice has never billed RPM before, there's going to be a lag in your reimbursement while they learn how to bill it, get a rejection, have to resubmit. And that's not only time consuming for your internal billing staff, that also takes them away from billing the other services that you're providing. By letting Medic do it, we've learned all the mistakes you can make in billing RPM over the last 3 years, and we're perfectly placed to do it in a more timely fashion, with minimal amount of rejected claims, minimal amounts of resubmissions. So the revenue that the practice sees is much more quick than if they're doing it internally or with a outside service. So again, the partnership that you choose for remote patient monitoring is going to determine whether in fact it gives you an ROI, and it also saves you money with your staff operations. And we're perfectly placed to do that. And with that, I'll open it up for any questions anyone has. We'll be happy to also schedule one-on-one conversations with you. My contact information can be retrieved from Market VinOps or my LinkedIn profile, and we'll be happy to discuss it with you. And if there's any questions today, please put them in the comment section. Thank you, Mark.
Thanks very much, Lamar. There's a couple of questions that were texted to me that I put in the chat. One is, what medical specialties can use RPM?
Virtually any family practitioner, any internal medicine, and for the most part, any specialty. We do a lot of work with cardiology, nephrology. We've recently found a reason to do business with rheumatology. We had overlooked the fact that rheumatology, rheumatoid arthritis, oftentimes affects a patient's blood pressure. And we can shortcut a potential hospitalization or an ER visit by that patient by being able to notify the doctor in advance that the blood pressure is elevated. So virtually within any practice, there's probably a chronic disease that they deal with that RPM can address. And just to digress a little bit, in order for a patient to qualify for remote patient monitoring, they need to have at least one of the 21 chronic diseases that CMS identifies. And in a population that's over 60 years old, that's not a high bar to cross.
So another question that was texted to me is there a startup cost associated with putting it into your practice?
The wonderful thing is there is no startup cost. The devices that we provide to the patient on your behalf are all cellular enabled. So as soon as the physiological readings are taken from your patient, it's uploaded to your computer, your tablet, your cell phone, for you to view if you choose. Our nurses are watching them constantly and will notify you if there's a need. But the information's on your electronic device for you to look at as well. We provide those devices at no cost. We provide replacement at no cost. And in the case of a patient who's using a blood glucose monitor, we actually provide the test strips and the Lancets at no cost. And it doesn't matter what the quantity is needed, whether they're testing once a day or 3 times a day. We'll make sure they have the quantity they need so they get the number of readings that you need each month to make it a billable event.
Very good. So I will invite Rick to come back on if he'd like and say a couple of last minute things if he's available. Otherwise, we will say a couple of things about our next Indie Practice webinar, which is August 25th. Oh, there he is. Our next webinar for Indie Practice Presents from the Medical Association will be the 25th, and it will feature Dr. Kishore Tipernini, the designer and programmer for a new software as a service called Tempeda that cuts the documentation time a physician uses on his EMR encounter during a patient encounter by up to 50%. It's a phenomenal software that saves a tremendous amount of time. Rick, let me give you the opportunity to say anything else that may have occurred to you that you wish you'd said before. Both of you have done very good jobs today.
I appreciated the time to review patient access with the team. And Lamar, I appreciated learning more about remote patient monitoring, and I think it's a wonderful space. And I look forward to working with anyone who's interested in scheduling time.
Outstanding. Good deal. Everybody who registered for this will get an email follow-up. And also, if they so like, a copy of the recording. And with that, I wish everybody a good day and thank you very much for your time.